So we're looking at anywhere from like 9 to 12 hours of sleep.
Yes.
Do naps count in that time frame, or is that separate?
Naps do count. Birth through toddler years need those 10 to 12 hours plus a nap.
So the nap I take on my office floor for 30 minutes does
I
not
also
count.
do that, but on my
Well,
couch.
Oh, there you go.
I think that counts. I think that counts.
I think it absolutely counts.
Good to know.
I think that there should be like a nap time at the end of a school day before extracurriculars and sports. There should be a 20-minute nap. I know I feel amazing after a 20-minute nap.
Yeah.
I wish nap time could come back for all ages.
It would be amazing. I don't remember the last time I took a nap.
Hello, and welcome back to The Vitals, Mount Sinai Health System's groundbreaking new video podcast. I'm your host, Leslie Schlachter, a neurosurgery physician assistant here at the Mount Sinai Hospital. Children are back in school, and families are juggling routines, schedules, and the many details that will help set up kids for success. Today, we're going to break down the essentials of a healthy and safe school year, from mindset and hygiene to screenings, nutrition, and backpack safety. To help guide us, we're joined by two of Mount Sinai's leading pediatric experts. First, we welcome Dr. Jennifer Duchon, an assistant professor of pediatrics specializing in newborn medicine and pediatric infectious disease here at the Mount Sinai Hospital. She works closely with families to ensure the health of children from birth through their school years. And joining us here is also Dr. Meredith Grossman, a pediatrician at Mount Sinai Doctor's faculty practice, who cares for children of all ages with a focus of preventative health and well-being. So I'm really happy to have both of you guys with us today.
Thank you.
So back to school can be a stressful time, right?
Stress-tember.
Yes, stress-tember. Oh, I love that. I've never heard that before. What would you say are some of the most important? I want to use the word health kind of broadly, because health, a lot of people think is like going to the doctor, medicines, illness. But health is also everything from like ergonomics of a backpack to how much cell phone time somebody is using. So what would you say are the most important health considerations when starting off the school year?
I would say probably the most basic thing that should be done is seeing your pediatrician for an annual well visit. And at that visit, you're going to address so many different things. So of course, we're always looking at a child's growth and developmental milestones. We're making sure they're up to date on vaccinations. We're checking their hearing, we're checking their vision. We're also addressing any underlying health problems that they have. We're giving anticipatory guidance as to what to expect based on the age and the stage. We're also looking at things like mental health, screen time, right? So there are a lot of things that are addressed at the visit. So I would say the first thing to do is make sure you've seen your doctor within the last 12 months.
Is there like a checklist that goes through? So on the annual visit, I'm sure the checklist has gotten even longer throughout the years. What does that checklist kind of look like? Everything that you just said?
Everything that I just said, and then any problems or concerns that the parents have. So we always start out the visit asking for questions, concerns, and updates about the child's health, about the child's mental health, developmental health, right? So all of that, it's really holistic. We're not just addressing medical issues, we're addressing the whole child.
Okay. And then, so as far as strategies for helping kids get back to school, is that something that you guys typically go through at a well visit, or is that something that you guys give handouts for or give YouTube links?
So it runs the gamut, right? I think generally we sort of inquire about a child's readiness for school. Certainly if it's the first time they're going to school, it's a very different conversation. But we do talk about school readiness based on each child's needs. So for a 5-year-old who's starting kindergarten, the conversation will be a little bit more about separation. Of course, we talk to everyone about sleep hygiene, but for a 5-year-old, basic developmental milestones are extremely important. As children get older, a lot of things stay the same, but we do start talking a little bit more about the academic rigor of school and certainly about mental health.
What would you guys say I want to kind of break up, if we can, the elementary age, the middle school, and the high school. And then I have a son who's a sophomore in college. So, for me, that's even more stressful now than it was back then. What would you say are some of, 3 of the most important things for each age group? And I don't even want to talk about vaccines or anything.
Sure.
Yet. Just vaccines, I know.
Vaccines, because I am a one-trick pony. So there you go. Okay.
I agree. Vaccines.
We are so going to talk about vaccines, but let's talk about things that we don't inject our body with yet.
Sure.
Let's just talk about like the general hygiene of readiness for school and putting your best foot forward as a child?
Sure. I think something that applies to every child, no matter what the age, is good sleep hygiene, right? The amount of sleep may change as the child gets older, but it's extraordinarily important for so many reasons. Good nutritional hygiene.
So hours, let's talk hours.
Sure.
Because good to some parents might be 7 hours, whereas good to me is like 9.
Sure. Well, I would say a general rule of thumb is that every school-age child needs somewhere between 9 and 12 hours of sleep, but the younger they are, the more they need. And every child has different sleep needs, right? So in that kindergarten, first, second grade stage, I would say 10 to 12 hours is aspirational. A lot of times it's tricky because younger children take naps, and as they get into pre-K and kindergarten, they start to drop those naps.
Right.
And so they're going a very long school day without a big rest period. So really 10 to 12. Now, some kids thrive on 10 hours and some really need those 12 hours. As the years go on and the child gets older, there are some kids who still need that 12 hours, but you know, as they get older, it gets a little bit less. Once you hit adolescence, we strive for 8 hours. I would say most of my adolescent patients are not getting 8 hours. There's a lot of homework. A lot of kids are up late on their phones, right?
Yeah.
So for many of my adolescent patients, I'm hearing 6 hours of sleep, and then they're making up for it on the weekends.
That was not like that before phones and
think
iPads. That cannot be how it's been.
I feel like it has been.
TV?
Yeah, TV or God forbid reading a book. How old is that?
I feel like that's okay, whereas like being up late at night watching TV, less okay.
I think we always probably did something to make ourselves as tired as possible for school the next day.
Absolutely.
Yeah.
And I think also their internal clocks shift a little bit. And so they naturally stay up later and they naturally want to sleep later, which is unfortunate because most school schedules don't change
they don't
as
allow
they
for
get
that.
older. So it's really tricky. But I would say sleep applies to all ages.
And then you said nutrition.
Nutrition applies to all ages. You know, I think we forget that food is fuel, right? Food is fun, but food is fuel, right? So you're fueling your brain and your body for the day, and having a really balanced diet is extremely important for energy, for mood, and a lot of teenagers skip breakfast.
My son didn't eat breakfast for 4 years, and he
Right.
still doesn't eat breakfast, and I cannot wrap my head around that. I mean, I feel like you should eat breakfast even if you're not hungry.
It's hard to force feed, right? And so many of these teenagers wake up not hungry. A lot of school-age kids, because they're, getting out of bed and, still waking up, it's hard to get breakfast into them. Breakfast really is the most important meal of the day, so it's really important.
So if there was like one thing you could tell like these middle school, high schoolers, grab just this one thing and eat that on your way to school, what would be that one nutritious thing?
Could they grab a yogurt and some fruit?
Okay.
Something that's easy to bring along that has protein and fiber. That would be ideal.
Yeah.
And a lot of kids don't have time to have a cooked breakfast in the morning. I will warn against a lot of the bars and
It's just like sugar,
packaged
right?
stuff. It's sugar. It's
Snickers bar,
processed.
yeah.
So not only will it might give them a hint of energy in the moment, but then they're going to have an energy crash right
Is that better
after.
than nothing though?
Probably better than nothing, because what happens is then lunch is several hours later and they're starving mid-morning. So I would say if that's the only option, it's fine. But then maybe try to have a more balanced meal for lunch and dinner if possible.
Okay, so sleep and nutrition. What would you recommend for just putting them into the best emotional and mental state?
I think open lines of communication is super important. I think we're seeing a lot of anxious kids of all ages. I think there's a lot of anxiety. There's a lot of social anxiety. There's a lot of anxiety around school. There's a lot of anxiety around the start of school. And I think shoving it under the rug isn't the answer. I think talking about it and labeling it, starting school is nerve-wracking. Starting school is really hard. Let's talk about it. And I think starting that conversation before, instead of the day before school, maybe 2 weeks before school.
Right.
And keeping those lines of communication open.
Is that like family dinners? That's probably where something like that really comes into importance.
Family dinners are aspirational. I think it's amazing and almost shocking if an entire family has the same available 30 to
really
60
hard.
minutes
It's really
every
hard.
day. I'll admit in my family, we try to do that every Friday, but it's really hard the other days of the week. But put the phones away, focus on the conversation. There are a lot of kids who don't talk freely, and it's a lot of one-word answers. So I love games that, not only model talking openly, but make it fun. So I don't know if you've ever heard of the rose, thorn, bud game.
No, tell us.
No, yeah.
So the thorn is the thing about your day that was the hardest.
Okay.
The rose is the thing about your day that was the best. And the bud is the thing you're looking forward to tomorrow.
Oh.
And so you can, as the parent, start the conversation and then allow everyone else to join in.
We do like what was the best part of your day.
Yeah.
Yeah. So I'll just add to that. That's a good idea.
Yeah. There are a lot of games you can play like that.
That all sounds great, but there are times that parents need like a prescription for that. So we're looking at anywhere from like 9 to 12 hours of sleep.
Yes.
Do naps count in that time frame, or is that separate?
Naps do count, but really young children, so birth through toddler years, need those 10 to 12 hours plus a nap.
Okay.
And school-age children really need 9 to 12 hours.
So the nap I take on my office floor for 30 minutes does
I
not
also
count?
do that, but on my
Well,
couch.
Oh, there you go.
I think that counts. I think that counts.
I think it absolutely counts.
Good to know.
I think that there should be like a nap time at the end of a school day before extracurriculars and sports. There should be a 20-minute nap. I know I feel amazing after a 20-minute nap.
Yeah.
I wish nap time could come back for all ages.
It would be amazing. I don't remember the last time I took a nap.
And then food, is there like a certain amount of calories like that you could tell a parent like, hey, your kid should really be getting in like 2,000 calories a day, or is that not really a thing?
We don't really like to talk in calories, even for a child who, where we're worried about their weight. Certainly if there is a child's extremely underweight, a child's extremely overweight, we're likely talking to a nutritionist or an endocrinologist anyway. But for most kids, we like to just talk in, meals, basically, meals and snacks, and to make it as balanced as possible. A lot of kids struggle with picky eating. It's very, very, very common. And so the best thing you could do is really, 1, model healthy eating, 2, make it fun, 3, not force your child. You can't force feed. And 4, I would say to every parent with a picky eater, have faith that it will get better, because the data show that really it does get better over time, and you just have to make it as positive as possible.
Do we have nutrition services here at Mount Sinai for kids?
We do. What's tricky is not every, most insurance companies, or not every insurance company, covers a nutrition visit. So sometimes it's a little bit tricky. If a child ends up being referred to our endocrinologists because they're severely overweight, part of that visit is with a nutritionist. And there are some nutritionists throughout New York City that take insurance, but not everyone does, and not everyone takes all of the insurances.
Okay. Let's talk vaccines.
Oh, please.
It's your favorite subject.
Yes. And general infectious disease,
Yes.
right? Because now your kid's homesick, like everyone's getting their fall respiratory virus.
Yes.
Summer's kind of like a little bit of a break. You may get your strep at camp, or you may get your little diarrheal illness, but really we sort of prepare in the hospital for the fall surge of everyone's back together, everyone's sneezing, sniffling. We don't, stay out of school just for a little bit of the sniffles, and then everyone gets it.
There would be no kids in school.
Exactly.
Yeah.
And teachers or us back to work. So
we have guidelines for, kids can't go to most of these schools without specific vaccines, right?
Yeah. So in New York City, we do have vaccine mandates. There are certain vaccines that you have to get to enter school. In this city, we don't have religious exemptions. Some places do, and we keep pretty good records of our vaccines here, so those are all bonuses. But of course, I'm wondering how many local policies and statewide policies are going to hold up. But that's
Wait, what do you mean? Like, because you guys were talking before that there might be some policy changes with like a specific age group getting, I think you guys were talking about RSV, right?
Yeah.
Like, what do you mean by that? Is it possible that these kids aren't going to get what they're used to getting?
Yeah. So we know that the COVID vaccines were recently pulled back for healthy children without risk factors for severe COVID. The governmental body, the voting arm of the CDC that votes for vaccines and makes recommendations for vaccines, has had a lot of changes recently. They're due to vote again on September 18th and 19th, and we know that on their ballot is going to be hepatitis B vaccine for the youngest children, a product called nirsevimab, which is a monoclonal antibody, an immunization for the smallest kids against RSV. Which is a respiratory disease that just kind of wreaks havoc, especially in the tiniest ones. But we see it surge with.
Yeah, there was a problem last year with that.
Yeah. There were. It was part of the triple-demic in 2022, where we saw COVID, flu, and RSV. So it's like around this time. And we're also worried about the MMRV vaccine, not the MMR per se, but the MMRV, which is, I believe you guys preferentially give that vaccine as the 4-year booster before children enter school.
So wait, MMR, so measles, mumps, rubella,
and varicella.
Varicella.
Yeah.
So they want to drop the varicella part of it, is what you're saying?
The vaccine. So there are a couple of vaccines against measles, mumps, rubella, and varicella. So one is the MMR vaccine.
Right.
That is given, and then there's the varicella vaccine, and then there's a combination product, the MMRV. So there's been some heightened awareness of the side effect profile of the MMRV vaccine. It's not contraindicated. Some pediatricians give it because it's one shot as opposed to two.
Yeah.
But many people will give the MMR and the varicella when kids are getting their first set of vaccines. Against measles, mumps, rubella, and varicella at 12 to 15 months of age. But then we have a school-age booster, or I shouldn't say it's a booster, a school-age second vaccine.
Like a second round, right?
Yeah. And that's to capture the kids who didn't get it the first time or may not have mounted an immune response. And that school dose, that prior to school dose around 4 to 6 years of age, has really been credited with helping tamp down a lot of endemic measles.
So what's the problem? Is it like what you said, something about side effects? Is there like a side effect profile that people don't like?
For the MMRV vaccine, it seems to have more of the side effects in children who are prone to febrile seizures. So in our particular society today, which has undergone a lot of changes, many of the negatives of vaccines are being played up as opposed to the really global positives.
Right. Like, here's your platform.
Here's my platform.
Yeah, tell them.
Right.
People think that vaccines cause autism. It does not. Like, over and over again, it doesn't.
Yeah.
So
the studies show that vaccines are safe. They've been studied in many randomized control trials. There are lots of really good data on the benefits of vaccines. And someone asked me in an interview, had I seen a death from a vaccine preventable disease? And I'm like, no, of course not. Oh, no, of course not. Because vaccines are sort of a victim of their own success.
Right.
We don't have vaccine preventable diseases because vaccines have prevented them.
Right. So what's the issue? They just don't want to pay for them anymore? Is that what it's coming down to?
I mean, it's basically a belief system. I think that we've shifted towards a belief system where the sentiment is that vaccines are artificial, that they have all these side effects, that they're not well studied, that they cause conditions that they just don't cause.
You're curling your upper lip, by the way.
And right.
You're holding it in.
And people respond to fear. I mean,
Yeah.
that's the natural course of things, right? Like if someone tells you something that sounds scary, you're probably going to Google it more than you will.
Right. Talk to your doctor about it.
Right. And when you Google, unfortunately, like if you Google vaccine side effects, 10 million things are going to come up.
So what do you tell your patients' parents? What do you, like, how does this conversation go?
I say, please talk to Dr. Grossman.
Yeah. So what does Dr. Grossman say?
That you trust.
Sure.
Who we have a relationship with. Don't talk to me. Talk to like you.
Right. And I talk to her to get all my information. But I think it really depends on where the family is. I will say I think there was a lot of rising vaccine hesitancy leading up to what's going on in the federal government. And I think that has propelled certain worried parents to a different stratosphere of worry. I always tell people if they ask, I vaccinated my children as early as possible with every single vaccine I possibly could. I also say that a lot of things have side effects, right? You know,
Right.
Motrin has side effects. Tylenol can have side effects. Anything can have side effects. The side effects of the measles can be lethal, right? The side effects of, you know, any of these diseases we're trying to prevent can be extremely dangerous. Many vaccines have side effects, they always have, but usually it is a much milder version of getting that actual illness.
Right.
And I often say, the fact that your child might have a fever after the flu shot is a sign that your
It's
child's
working.
immune system is
Hooray.
responding and the vaccine is actually working.
Yeah.
It's not a bad thing, but it's very hard. And of course, I try to not be judgmental. This is their child, right? They want to feel confident about what they're doing. I do say most of these vaccines have been studied for decades and decades,
Right.
and there's extremely compelling evidence about their safety and their efficacy. And like anything, you know, nothing is a guarantee, but I feel, you know, I would never do something to your child that I think would put them at risk. I'm here for your child's best interest and well-being.
What about when they want to break them up? Like we know that their immune system can handle multiple immunizations together. What do you say to the parents that are like, that's too much for today, we'll come back another day?
It's not my decision, it's theirs. So if they do want to space them out, I will do that.
But do you educate them that that's not reality?
Yes, it's not beneficial. In fact, sometimes I think it's even more detrimental to the child to bring them back on multiple occasions for pokes. But if that makes them feel more comfortable, and if that's the difference between not vaccinating and vaccinating, I'm happy to do that. My practice actually does have a vaccine policy that you have to initiate vaccines by a certain age and complete certain vaccines by a certain age, mostly because we share a waiting room with a lot of...
Like to stay in the practice, they have to
stay in the practice, unfortunately. You know, at Mount Sinai, we have a lot of children who are medically fragile, so they might be sitting in the waiting room next to a child who's had a solid organ transplant.
Right.
And so if there's any risk that they could have the measles and give that child the measles, it's really not safe. So in our practice, we do have that policy. Not every practice does.
What do you say to the parents? This is probably why I don't work in pediatrics, because I would not be able to bite my tongue. To parents who are like, oh, but it's synthetic, there's preservatives. I want to be like, are you giving your child a completely organic diet, or do you not use products on your skin? Like, that's insane to me, but people say that.
I mean, it's such a hard topic because, yes, but there's also, you know, did you eat that bag of chips?
Right.
You know, what's the preservative?
Did you have
in
a
that?
Nutri-Grain bar?
Right. And did you have
every
a Nutri-Grain
morning?
bar?
Yeah.
Did you drop something on the pavement and pick it up? So I
guess, is that not socially acceptable in a medical practice to say these things?
It's not. It's not. So that's why I'm like looking at Meredith. I'm like, but what do you say? There are a lot of good informational sites telling you. First of all, many preservatives have actually been pulled out of some of our vaccines. So we don't generally use things like multi-use vials anymore.
Right.
Thiomersal, which was a big deal in the MMR vaccine, a lot of people were very concerned about that, was actually pulled out of the vaccine products. And the preservatives that are there are extraordinarily common. They're used in a lot of different food products, medication products. They're not intrinsically harmful.
Yeah.
I am so lucky to work with colleagues on the ground who, again, will be like, listen, I'm not doing something that's harmful for your child. It's what I did for my kid, or like, I have this relationship with you. Trust me.
Right.
And that's really, I mean, it's hard for me to say.
I think
it's even harder.
I think it's a lovely
Right.
thing for a practitioner to say is, please trust me.
Yeah.
Like, we would not do what is not best for your child.
Right. It's really hard for me to say, no, trust me, that amount of aluminum is trivial. I mean,
Right.
So
Right.
it
Yeah.
sounds fishy even me saying it. But it is.
But it is. But
Right.
it is. Yeah. No, I mean, we're lucky here at Mount Sinai to be able to work with people and specialists in infectious disease, environmental medicine, and we know all of these things.
Yeah.
And we're working from a public health perspective too to like do better. Okay. So is there anything else we want to add about vaccines?
Well, I'll just add on that in life, there are no decisions that are perfectly easy, and there are a lot of, you know, weighing pros and cons. And so if there's this bit of hesitancy about what the vaccines are made of, I always say, but think about what could happen if your child gets that disease.
Right.
And I never like to scare parents, right? But if you've been around long enough to see some of these diseases, they're very, very scary. And I think to Jen's point earlier, we don't see a lot of these diseases because of vaccines. And so I think we have, a little bit of memory loss about what polio was really like and what diphtheria was really like. And so just if you're in that sort of place of making this decision and want to make the perfect decision, there is no perfect decision. It's about making the best decision you can with the information at hand and weighing the pros and cons. And the benefits of preventing these lethal diseases way outweighs any of these other things that we're discussing.
I mean, we all remember what COVID was like, and people don't want to get boosters that are at risk. That's crazy to me.
Yeah.
But so what's the party line right now about COVID boosters for children? Let's categorize them, like at risk and not at risk, obviously.
Right. So the American Academy of Pediatrics, and in fact, New York State, has endorsed that all children 6 months to 23 months of age receive an updated COVID vaccine. So it's now COVID vaccines are like the flu. We target a different strain every year. So little tiny kids do get 2 vaccines or get a series of vaccines. But over the age of 2, they're getting 1 vaccine.
Okay.
We may have to fact check that.
Somehow we'll put a link below saying, look, click here for the updated.
Yeah, perfect.
Yeah.
I think it depends on if they've received a primary series
or not. Yeah.
Okay.
Absolutely. The vaccine, luckily we have really great resources through the American Academy of Pediatrics, and New York State has a great website on vaccines. So the American Academy of Pediatrics and New York State are officially recommending a COVID vaccine for all infants 6 to 23 months of age.
Okay.
They're recommending COVID vaccines beyond that age for any child who's at high risk for getting severe COVID, or if they live with someone who has risk of having severe COVID disease. Or
so we're talking like a 12-year-old maybe with asthma.
Yep.
Or a 16-year-old who lives with a mom with COPD or something.
Exactly. Okay. Or if they live in a congregate setting. So colleges, boarding schools. And then any child whose parents want the vaccine for their child, want that protection. The American Academy of Pediatrics and New York State endorse that parents have the right to choose that for their children, to have that protection.
Okay.
I'll also highlight that some of those underlying conditions that will qualify you for a vaccine include things like developmental delay and autism, obesity, physical inactivity. So a lot of kids actually will qualify. And so we're excited and happy to vaccinate anyone who
you're like,
wants
everyone
falls into those categories.
Yes, exactly.
Okay, let's talk about things that sometimes are a little bit slower to pick up. So you talked about at the wellness check, you do things like, hearing tests. Mm-hmm. How often should those like elementary, middle school, and high school age children be getting their hearing and vision checked?
Every year, actually. We start testing vision actually at 12 months of age with what's called an ocular screener. And it's sort of a digital way to check the eyes. Reading from the chart, we call it the Snellen. That one you can't do until you're able to read from a chart. So most kids...
Unless you do like smiley face, sad face, flower.
Right. Yeah. So most kids aren't able to do that until close to age 4. Right. So we use that ocular screener up until that point. We attempt the vision screen at age 3, but usually it's not until age 4. Yep. Once you hit age 4, it's yearly.
Okay.
We also start testing hearing around the same time as well. We try at age 3. A lot of kids aren't able to follow those instructions, and so we routinely start at age 4, and we recommend doing that yearly. If there are any additional concerns about hearing and or vision, we'll ask a parent to bring it to our attention and to send them to a specialist, even if they pass their hearing and vision
I'm sure
screens.
the majority of the time, the parents are like, something's definitely not right here.
A lot of parents are very intuitive, and so if a parent is worried, I'm worried.
Okay. Can we talk about weight also? I know from personal experience that being heavy in a school setting is not only unhealthy for a child, obviously, but can also be really emotionally distressing. How do you guys handle, even like mild obesity? How do you handle that in school-age children?
It's a very tricky conversation, right? Because there is a lot of anxiety about body image. And I do think social media has contributed to that in a big way.
For sure.
So you want to have the conversation in a non-judgmental way, and in a way that a child can understand. You also don't want a child developing a negative body image because of that conversation. So it's a very delicate conversation, in my opinion. I will say I do try to always spin it towards the positive. So let's talk about the ways you're keeping your body healthy. Tell me about all the foods you eat to fuel your body. Tell me about the exercise you're doing. And I never ever talk about how a child looks, but I do show them the growth curve. I show the parents the growth curve and I show the child, and I just explain what a growth curve means and what certain deviations might indicate, and that it's really, again, not about how you look, but about the health implications of a rising BMI. For example, BMI is body mass index, which is essentially a measurement of your weight compared to your height.
What have you guys seen as far as like diabetes starting earlier in children? What does that look like over the years? Because I feel like we're just getting bigger and bigger.
Yeah. Obesity is an epidemic in this country. And I think COVID really had a big impact on obesity. A lot of kids were home.
Yeah.
They weren't going to school. For some kids, their main physical activity is physically going to school, being in school, doing physical education at school, and coming home from school. If you take that away and there's not other opportunity for physical activity, you see a weight increase. And so we saw a lot of children with significantly increased BMIs after the pandemic.
Do you tell children at their yearly visits like how much physical activity they should be getting daily?
I do recommend at least 3 to 4 times a week trying to do something that gets your heart rate up for about 30 minutes if possible.
Like playing a game or something.
Yeah, and it doesn't have to be proper exercise. It could be taking a walk. It could be going to the park. I often say if there's an elevator or a stairwell and you have the opportunity to take the stairs, try to take the stairs.
You're so lucky there's stairs. Take them.
Right, right, exactly.
That's how I feel about stairs. I love taking the stairs.
Yeah. I do run up a lot of stairs to deliveries in Mount Sinai. Yeah.
Yeah, I can imagine what a tough subject that is. I know as a parent, when my son was younger, he was heavier, and he, with us, was very distraught about it. He would pretend like he wasn't in front of other people. But I know that was something that really bothered him until he kind of grew out of it. And it really affected him for several years in his friendships and his socialization. You know, it really does go past just the health implications of it. There's mental health too.
Absolutely.
Yeah, it's tough for parents.
It really is
deal
hard.
with that.
And body image is something that a lot of kids struggle with, and it's something we try to bring up at well visits with teenagers especially. But I will just encourage everyone to sort of try to use as much positive language as possible, especially parents, when it comes to, instead of saying, don't eat this, it will make you fat, but what can we eat today that will, give your body fuel and make you feel good and make you feel energized?
Well, I think what you said is really important for our listeners to hear, for anyone who's a parent out there. If you are worried about your child being heavier than they should be, I mean, scheduling an appointment with your pediatrician to look at the growth chart and look at the curve and talk about the health implications of it, that's a reasonable visit to schedule.
Absolutely. In fact, once you hit age 3, you only have a required visit with your pediatrician once a year.
Yeah.
But for many children, whether their weight is climbing or they're actually falling off their growth curve, I'll actually schedule follow-up growth checks more frequently. So I might say, you know what, come back in 3 to 6 months. Let's take another look at the growth curve and see where things are, because one point in time might not be enough information, and waiting an entire year could also be super detrimental.
Okay. You wanted to add something to that.
Yeah, no, I was going to say, I just think it's really interesting because here we're talking about vaccines, and we're talking about nutritional health and sleep hygiene all together as positive interventions. And it seems like, to me, that that the vaccine component has just been pulled out of health.
Right.
And it doesn't. It shouldn't be. Like, we should just be doing what we're doing here, talking about all these things as sort of a bundled intervention to make your kids healthy.
Absolutely.
I think it's actually completely crazy. I feel like we're in a society where everybody wants a quick fix. Everybody wants that special pill or the shot. People want to go on Ozempic for weight loss instead of doing whatever it is that they're going to do. Here we have injections vaccines that will make things so much easier, but we're still coming up with problems for that.
Yeah. We're preventing the problem.
No.
Right.
No.
Preventive medicine.
Right. There's a magic shot that will prevent measles. I can give it to you. It's fine.
Oh, no, I don't know. Yeah, no, it really doesn't make any sense. Yeah, I can't wrap my head around it.
We're somewhat moving in a direction based on our politicization of medicine, but some of those things are good, like the focus on nutrition, the focus on, avoiding highly processed foods.
Absolutely.
Like if only we could just keep everything else going as well.
Absolutely. That's all in the interest of preventing disease.
Yeah. I want to talk a little bit about hygiene, which I can't believe we're talking about, but in school-age children, they don't like to wash their hands or shower. Like really, I mean, for years I remember having to be like, you need to get in the shower today. Now, I have a 17-year-old daughter who would shower all day long if I let her.
Right.
But let's talk about just like the basic stuff. Can we talk about hand washing versus sanitizer? Like what is really good hygiene for school-age kids?
I think if you have access to soap and water, that's always ideal, especially if you see visible dirt and particles on the hands and fingers. But hand sanitizer is a great second option as long as you're using it properly and rubbing your hands until it's completely dried up. I usually say, at 20 to 30 seconds, ideally. For really young kids, I say sing a full round of ABCs and then you're done wiping your hands together.
That's a really long time. Kids do not have.
It is a really long time. It is.
Yeah, and I'm happy with just about anything.
I feel like if in all bathrooms in schools there was like TikTok playing on the mirrors, they would all wash their hands for 20 to 30 seconds.
We should all do that.
Brilliant idea.
That is a really good idea.
If there was like something playing in the bathroom, kids would be in there washing their hands. Like it only plays if the soap gets dispensed and the water is running.
Exactly. Yeah. That's actually really good.
That's a great. Or the TikTok could be about
you
hand
could invent
washing.
that. And
yes,
then,
you could.
And then
I feel like I'm. Yeah, I don't know. We have to maybe not put this out until I patent that.
There you go.
But okay, so if obviously visible dirt, really grimy, soap and water, but like sanitizer, if we have to, that's fine.
Absolutely.
Yeah. Okay.
Especially, so I think that not having phones in school during the school day is actually kind of a great thing also for hygiene.
Yes.
Your phone is filthy. Yeah. I mean, sometimes in my department, infection prevention, when we have like little, health fairs, the station that everyone wants to go to is where we swab your phone and tell you how filthy it is. Like tell you exactly like
people don't wipe their phone. I wipe my phone down with a hydrogen peroxide wipe 3 times a day.
Oh wow.
Like at work, but not like at home.
Right.
People don't wipe their phones or chargers.
No.
Most I've learned.
Most don't.
Like, people need to wipe their phones.
And kids especially. So I'm wondering what effect, if any, that's kind of going to independently have on like just general spread of germs. Although of course we had lots of germs before we had cell phones. Yes. But like touching your cell phone and then like touching
or like bringing
else.
your cell phone into the bathroom and using your cell phone while you're going to the bathroom, putting it down to wipe, and then my kids bring their cell phones into the bathroom. I'm like, are we really doing this?
Yeah, right.
My poor kids are getting outed on this podcast.
No, that's pretty bad. That's all right, because everyone else kids do it too. Yeah. So,
and like daily showers, people should be taking daily showers, but not necessarily having to like wash their hair every day. Like,
I mean, I'm happy if you just wash the part that's going to touch other people, which I hope at generally school age is your hands.
Yes,
I hope so.
So you know what? At a minimum, please, like wash the other parts as you see fit. But yeah.
And once a child starts to go through puberty, they may need a more frequent shower. So that's something that we also talk about. But I agree with Jen. You don't have to wash your hair every day, but rinsing your body and your hands, very important.
So I know we were talking about dirty phones, but I want to talk actually about phones. So when I was growing up, it was television, right? And I had access to whatever was on when I was sitting at the TV or whatever it is that I might have taped, the night before. But now our children have access to their phones and iPads and all these social media outlets. They also have access to on-demand everything through Apple and Netflix. What are healthy, appropriate tech choices now? I don't want to be like, you can't do this because that's how they talk to their friends, but there has to be some sort of guideline for us, for our children.
Yes.
So can you speak about that?
Sure. It's very, very tricky. And there's still so much emerging, research that's being done. But obviously we say to limit screen time as much as possible. Ideally, if you can keep it under 1 to 2 hours a day, which sounds like a lot, but when you hear what a lot of kids are doing, it's
Hour.
twice that,
6 hours.
3 times that. also making choices as a family as to what you think is appropriate and setting limits. So, there are certain age limits or cutoffs for certain social media apps, right? And, I think as much as close to sticking to them as possible is ideal, right? So a lot of social media apps say the minimum age is 13, right? Because the younger you are and the more exposed you are, the more of a detriment it is to your physical well-being, your mental health.
Right.
And, within each family, you might have time that is screen appropriate and times where you say the screen has to go off, whether it's mealtime or before bed. A lot of kids go on their phones before they go to sleep, and that can actually prevent a child from going to sleep.
It prevents me from going to sleep.
Prevents me from going to sleep too. And cat videos, what are you going to do? I mean, I'm sure.
I get stuck with the dog videos.
There you
for
go.
an hour I can watch dog videos that mean nothing to my life.
Yeah.
Right. And I think also, I did read an article recently where, again, the research is still evolving. And for some people, actually, depending on what they're looking at and for how long, it might not be a detriment to sleep. But for a lot of children, it really, really is. It's very stimulating. And so ideally, we say to put the screens away an hour before bedtime, read a book instead. That's aspirational. But I would say really having a conversation in your own family about what you feel is appropriate and trying to stick to the guidelines as much as possible.
Right. Yeah. And what age, when parents ask, is there an age that you recommend, is like typically for, how old did you say your kids are again?
12 and 15.
What is 15? 15 is freshman?
So freshman, sophomore.
Okay. So I know for us in like our school system, everyone got their kid a phone going into 6th grade because they were like they were leaving home. They want to know where their kid was at. They want to track them on Find My Friends or whatever. What age is a solid age that you think is reasonable to give someone a phone?
Well, I think, it's family dependent. In my family, we did start the phones in middle school when our children started going places by themselves.
Right.
And we needed to get in touch with them and know where they were. Getting a phone doesn't mean getting social media, right? So you can have a phone with the ability to call or text without having Snapchat, TikTok, and Instagram. So I think it is, again, really family specific.
Right.
Our school tried to have a wait till 8th policy.
I'm sure that did not work.
And I would say majority did not stick to that.
Yeah. Also, like, I put restrictions on my children's phone when they were younger, but they find ways around it.
Yes.
They find ways around the restrictions.
Yes.
There's like secret apps that cover the apps. And there's ways that, like, if you can put time limits, I have a time limit on my daughter's phone and she just clicks right out of it like it's nothing.
Right. Yeah.
Sometimes those don't even work.
Right. You can restrict the amount of time on the phone. You can restrict the amount of time on specific apps. You can restrict what they're looking at. And if the child finds a way around it, change the password if you need to. But I think also it goes back to open lines of communication. Why, telling your child why you think this isn't good for them, right? And every minute they're on the phone, it's not just extra time on a screen. It's time they could have been outside or physically active or doing something else.
Yeah.
So I think it's a double hit, in my opinion.
Yeah, I just had this conversation in the car this morning with my husband. My daughter, it's hard because I want her to have access to her friends on her phone.
Right.
So if she's not done with her homework until 10 and I know she's not going to fall asleep until 11, I don't think it's unreasonable that she can be on her phone for a while. Yeah. But then it's a little too long. Now, I have no problem taking her phone away and be like, I'm sorry, you can roll your eyes at me all you want. I feel nothing. Whereas my husband is like, oh my God, if she's mad, I don't want her to be like, we are not there to be our children's friends.
No.
Like, take the phone away.
No.
Also, they can see stuff on their computer. You need to take that too.
Of course.
Right.
Of course.
Yeah. Or they need their computer for their schoolwork. Well, not if their schoolwork is done. We can take it all away.
Absolutely. And I agree, you're their parent, not their best friend. You could be both, but parent first and foremost. Yeah. And I think there is a lot of data that shows kids really need and want the structure. And as much as it's uncomfortable to see them squirm and get upset and yell and be mad, they actually really do need that. They need you to say, I'm setting a limit here. It makes them feel protected and secure.
Yeah. I have, it's more of like maybe your opinion of how you recommend parents doing it, but there are a lot of children out there who have chronic illnesses or something where they need to be involved with a school nurse. I have friends whose children are celiac or type 1 diabetics, and they're attached to their Dexcom, and there's beeping and all this stuff going on, and there's constant fear of like, is my child getting exposed to gluten? What is your recommendations on how parents can develop a relationship with a school nurse for all hosts of those chronic illnesses that they have to deal with? Because that's a really important relationship.
Sure, no, of course.
Health,
absolutely.
I'm lucky to have you here.
I'm lucky to have you here. So first of all, in order to go to school, children need health forms filled out by their pediatricians. And the people that review those forms are the school doctors and nurses. And I've actually had a great history of interacting with school doctors and nurses. Sometimes they'll call and say, we couldn't read what you wrote. What is the dose of this medication? But you want to, as pediatricians, we try to be as clear as possible on these health forms, because that is the go-to for any school nurse or doctor if a child enters their door, having an asthma attack or having low blood sugar.
What are the most common illnesses that you would say the school nurses have to be in touch with you about?
I would say asthma and food allergy are probably the most common. And those are probably the most common things we're filling out on school forms that we really want school nurses to know about. If the child has an asthma attack, what can be given in school? If a child has a food allergy, what can be given in school?
Okay.
There are some kids who do have multiple medical issues or very complicated medical issues. In those instances, I sometimes get a phone call from the school nurse just reviewing the health plan. Sometimes there'll be a dialogue between the parent, the nurse, and the pediatrician. So we try to be as communicative as possible. And there are really, this at least in New York City, the school-based health program and providers are really excellent, very detail-oriented.
Do you recommend that parents have like an ongoing meeting with school nurse, or just like the beginning of the year to establish the plan is usually good enough?
I think at least a one-time check-in at the beginning of the year just to make sure everyone's on the same page. If things evolve and change, then I think it's appropriate to have a follow-up meeting. So if the child's asthma becomes more severe and we bump up the medication, that requires a conversation with the nurse and a change in their school forms.
Okay. Do you want to add anything to that?
No. She's definitely said it all. I mean, I'm really lucky that, I kind of live in a little bit of an ivory tower, right? I get to say, oh, you have to do this, you have to do that, you have to do this, like as an epidemiologist. But Meredith has to actually implement it all, keep it all straight, and make all the recommendations and keep up to date. And we're really lucky to work with our pediatricians on the ground.
We wouldn't survive without her. Anytime there's a vaccine issue, we call Jen and say, what are we going to do
This
next?
seems like a lovely symbiotic relationship.
Yeah, we do try. Our offices are actually not that far. Yeah. Right.
So when like my school age, we carry these huge backpacks with heavy notebooks and heavy books, but that's kind of like gone away because a lot of stuff is on.
My bag is really heavy.
I know, but that's
right?
That's age appropriate for us.
Right.
But our kids walk around with their like computer or iPads. They're using Google Classroom. Generally, their books at home. Are there any physical safety, ergonomic tips that you have for school age children? I don't even know what comes up anymore.
Yeah, well, I would say, first of all, there are some kids who take all of their books back and forth to school every single day. And I think this is a good exercise in executive functioning. What books do you actually need? What tests do you actually have tomorrow? And what homework do you actually have? And actually practicing leaving some of it in your locker at school. But a lot of kids do have a lot of stuff, even if there is a lot of iPad usage. They do still have a lot of notebooks and textbooks and things like that. We do say if you're going to have a backpack, make it a sensible backpack. Make sure you're placing things in the backpack in an ergonomically appropriate way.
Right.
Ideally, do a thick padded strap. Put both straps over your shoulder instead of one strapping it.
That's not cool, Mom.
It's not cool. It went through a phase of being not cool. Now I think it's two straps. It's back. I think it's cool again.
Right, yeah.
Make sure the backpack is secure enough that it's not hanging very low on the lower back.
Yeah, they make it really loose so it like flops on their
Exactly.
butt.
So you want to tighten the straps. When you're picking it up, you should bend your knees to pick it up insteed of bending your back.
Good life advice.
It's good life advice, right? We should do that with our heavy bags.
Sure,
And that's the best you can do, honestly.
I see the kids, I live on the Upper East Side, they wheel the wheelies, like the suitcases, and I'm like, yes, I love is it okay to love the wheelies?
Absolutely. I don't know that a lot of kids love the wheelies, but I do think that's a great
Upper East Side
solution.
kids use the wheelies.
Oh, do they?
Some kids really do.
Yeah.
Some kids really do, but I see a lot of backpacks too.
Yeah.
Yes.
Yeah. Okay, so executive functioning. Only bring the books back and forth that you need that day.
If you can plan that far in advance, it's hard sometimes.
So what would you guys both say are your top 3 tips? And it can be mom, dad, or caregivers, or the child. What are your top 3 tips for beginning of school year? I know what yours are already. Your top 3. They're all the same.
Exactly.
What are yours?
Well, vaccines.
Oh, okay.
Well, check in with your pediatrician to make sure that you're up to date. So the recommendations change, and obviously they're different for different ages, and new products do come out. Now we're immunizing teenagers against different kinds of meningitis. So there are updates. So talk to your pediatrician, find out if you're actually up to date on everything that you need to be, because school doesn't require everything, but there are a lot of vaccines that are really important just for health that aren't necessarily like, I cannot go to school unless I have them.
Yeah. So for teenagers, it could be something like the meningitis vaccine, making sure they get their flu, even like the Gardasil vaccine for certain age groups.
Yeah. And again, we're starting those in younger age groups now to just like we do for hepatitis, to get ahead of any kind of curve. So yeah, and those are, you know, those recommendations have changed, and they change from year to year. So always good to check in to make sure.
So what link should we put below? Is it the CDC?
It's going to be the American Academy of Pediatrics website.
Okay.
Yeah.
Okay.
The American Academy of Pediatrics has put out a vaccine recommendation. I'm going to be honest, they don't always now align with the CDC recommendations.
Okay.
And again, there's a lot of discussion about vaccine schedules. New York State has endorsed for the COVID vaccine, the American Academy of Pediatrics recommendations.
Okay.
And I expect that they'll continue to do that for the entire schedule.
Okay, so preferably look as soon as possible because it might change in the next couple months.
Yeah.
Okay.
Exactly.
Ideally. What about you? What are your top 3?
Aside from vaccines,
Yes.
I would say make sure to have an annual check-in with your pediatrician so you can review everything. Do not underestimate the importance of, you know, sleep, nutrition, mental health, all the things we discussed. And I think what we spoke about, just open lines of communication between parent and child and the school, is super duper important. And just kind of be on the lookout for any changes or concerns you're having about your child.
Yeah. I think I want to join too, because I learned 3 things today, or maybe just like reprioritize them in my head, is that we're not our children's friends, we're their parents. And if we feel that they're on their phone too much or not sleeping enough, to like prioritize that and explain it to them. The second is you don't need to only see your doctor once a year. You can make an appointment for something that's concerning to you and have the doctor speak about it in a way that's medically meaningful to your child.
Absolutely.
Yeah, so I hope that helps other parents too. Is there anything else that you guys want to add before we finish up?
Times are kind of scary, huh? There are a lot of changing recommendations, and it can sometimes seem like it's difficult to know which organization, which body of evidence to trust. But your pediatrician has been there since the beginning with your child. You guys generally have a relationship with them. So I would just reaffirm that, you know, you really continue that relationship and check in.
I think it's really important to say, because a lot, like especially here at Mount Sinai, a lot of us have access to the MyChart. And the MyChart is an app that the patients can use to look at their care. And what's really great about it, and this is what I do for my children, is I go into their MyChart and I click, you know, immunizations, and it tells you what they're due for. Like, thank you. Oh, I don't need that. Thank you. Like making sure that we have access to our children's medical records and staying with an institution like Mount Sinai that will keep everyone up to date is really important.
And obviously it's not just for vaccines. A lot of recommendations about nutrition are changing.
Absolutely.
About sort of the way that, you know, we prioritize our time and life and school are changing. So, you know, again, your pediatricians all have the best.
Do you have like a smart phrase for that? Read
Yeah,
exactly. Every
exactly.
time.
I do think, just to piggyback off of what you're saying, there's just so much anxiety in parenting. And I think for good reason. There are a lot of things in the world to be worried about. But there are certain things that I'm really confident in, which is that certainly vaccines work, but also going to your doctor for preventative care actually really does help. And so to trust your providers and to trust what we've been doing for decades and decades, that the evidence supports.
Well, thank you guys so much for being here today. I really appreciate your time.
Thanks for having
Thanks for
us.
having us.
Yep. That's it for this episode of The Vitals. I'm your host, Leslie Schlachter. Subscribe to The Vitals and Mount Sinai's other podcasts on YouTube, and find us on Apple Podcasts, Spotify, or wherever you get your podcasts. For more information on how to get your child seen here by one of our expert pediatricians at Mount Sinai, or to have your child vaccinated here at Mount Sinai, you can scan the QR code below or click the link for more information.